All right, when you are ready.
Levi Rosenbaum called himself a matchmaker, but his business wasn't romance. Instead, authorities say he brokered the sale of black market organs, buying them from vulnerable people in Israel for $10,000 and selling them to desperate patients in the United States for as much as $160,000. The issue of organ trafficking, or the procurement, transportation, and transfer of a living or deceased person's organs for the purpose of commercial transactions, has grown exponentially due to the shortage of organs for transplantation, leading us to seek the answer to the question of, should the brokering of black market organs be legalized to provide a better quality of life for those individuals in need? Good morning, my name is Hunter Epps.
I am Jacob Zero.
And I'm Lydia McRoy.
The world of organ donation began in 1954 due to many medical innovations and a lot of research into the human body, with the first successful kidney transplant performed by Joseph E. Murray and his associates at Peter Brent Brigham Hospital in Boston, Massachusetts, followed by the first successful liver transplant in 1963 performed by Thomas Starzl, the first successful heart transplant performed in the 1960s by Chris Bernard, and finally medical advances led to the first successful lung transplant in the 1980s performed by James Arty. Due to all these medical advances, the United States government decided that there needs to be a governing body to regulate the trade of human organs. This is why, in 1984, the United Network for Organ Sharing, also known as UNOS, was established as an independent, nonprofit organization that supports the efforts of donation and transplantation professionals. Then, in 1984, UNOS received the Organ Procurement and Transplantation Network contract, which makes them the only legal body that can regulate the trade of human organs. But this does not stop the illegal trade of human organs through the black market. This can be attributed to the shortage of organs for transplantation due to the lack of organ donors. According to the United States National Medical Library of Medicine, this is caused by a distrust in the system that there is a market out there for human organs. As a result, 18 people die each day awaiting organ transplants. Accordingly, the United States Department of Public Health, a cabinet-level department of the United States federal government with the goal of protecting the health of all Americans and providing essential human services, reports that there are just under 130,000 patients awaiting organ transplants. But due to the shortage of organs for transplantation, these patients can wait anywhere from 3 to 5 years, during which time they're unable to work, do the things they once loved to do, while also diminishing their quality of life, motivating these desperate patients to seek an alternate organ procurement source. Why these potential recipients see this as a chance at a better life, a chance to do the things they once loved to do without having to worry about their failing organs. But what they don't see is the possible negative consequences, such as bleeding, infections, wound complications, even death, while also putting themselves at a heightened risk of contracting a communicable disease such as HIV and hepatitis. A more in-depth look into the economic standpoint can provide vital insight into what also motivates these individuals to seek this alternate organ procurement source.
The brokering of organs can be a very lucrative process. With nearly 4,540 people dying each year waiting to receive an organ transplant, there is a large gap present between the supply and demand of human organs. With such a large demand for human organs and such a low supply, not only will organ prices rise dramatically, many people who are in desperate need will go looking to other places to procure an organ, many of which are willing to pay top dollar, resulting in a great rise in the black market of human organs. Nearly 5,000 to 6,000 human organ transplants are done illegally within the United States alone. To truly understand the value of human organs, we must first be an understanding on the average cost for an organ transplant. As you can see, transplants can become very expensive, as a lung transplant can be billed up to $862,000 and a heart transplant can be billed up to $1.4 million. One of the many reasons why people will go other places looking to procure another organ. For example, many of which will go to hot spots within the organ trade like China and Pakistan. This will lead to many hospitals missing out on opportunities economically. As stated in the article, "Do You Hospitals Push for the Organ Black Market?" An article from CBS News, a well-known news source within the United States of America, each organ transplant that occurs within a hospital can bring in thousands of dollars. With many transplants occurring illegally across the world, these hospitals are missing out on opportunities to improve their health care. As not only will hospitals gain an advantage, also the people around these hospitals will. With nearly 1 billion people every day making less than $1, and 2.8 billion people worldwide making less than $2 a day, allowing people to sell their organs would provide many with a better source of income, giving people in need a way to get back on their feet. Although legalizing the brokering of organs can be very beneficial, many laws and restrictions would need to be passed to keep this ethical. To truly understand why these laws and the restrictions would need to be placed, there must first be an understanding on the ethical issues that comes with the selling of organs.
The range of different positions regarding the selling and buying of internal organs suggests that the moral argument of markets for organs is a complex and a context-dependent issue. As you can see from the chart from organdonor.gov, the official U.S. government website for information on donation, the United States, in blue, only stands midway in developed nations with 26 donors per million people. With the number of people in need for an organ transfer, it is understandable for people to suggest purchasing organs. However, purchasing organs does not only violate United States law, but it is also looked down on morally. One opposition to organ markets is that selling a person's internal body parts is morally wrong. This philosophical view is best expressed by the 18th century philosopher Immanuel Kant. He believed that every person, regardless of status and wealth, has a worth beyond price. Therefore, for those in agreement with Kant's philosophy, selling an organ is always considered to be wrong, because this action fails to express proper respect for the seller's self-worth. Another opinion of this issue is of the people and the market proponents that insist that the legal prohibition of commerce in organs is a grave mistake. However, others argue that legalizing markets in human organs is required to respect the moral values in personal anatomy and human well-being. It is well known that a thriving black market exists in human organs, and it's also known that the vendors in such a market suffer from a variety of abuses ranging from fraud to outright coercion. According to the World Health Organization, an organization dedicated to directing international health within the United Nations system and leading partners in global health responses, an estimated 10,000 black market operations involving purchased human kidneys take place per year. Often, those involved in this process undergo serious psychological and physical harm due to interpersonal coercion. This practice of persuading people to sell their body parts by using force or coercion is not ethical.
However, if proper legislation is passed and organ markets are legalized, the abuses that now occur with the black market can be avoided through regulatory control. Governmental authorities would need to enact laws and pass legislation to crack down on the illegal sale of human organs. One example of this would be the Transplant Act of 1984, which states that any individual convicted of selling or buying a human organ would be convicted to 5 years in prison and be charged with a $50,000 fine. To do this, the World Health Organization would need to enact the regulations around the world while also enforcing these regulations around the world. Along with this, there needs to be education about the benefits of legalizing human organs, as well as awareness of this issue.
One limitation to this solution would be the different political climates around the world that will make it difficult for these laws and regulations to take effect. It still remains unclear exactly how much regulated markets would actually increase the supply of organs. However, legalizing markets in human organs might result in the widespread unethical misuse that is present in the black market currently. Along with the ethical concern, it would be hard to pass legislation, and there would be opposition to educational initiatives, as well as a possible lack of funding.
So in conclusion, to combat the current organ shortage, governmental authorities would need to enact legislation to legalize the sale of human organs, while also cracking down on the amount of illegal organ transplants worldwide in an effort to regain public trust, while in turn leading to more organ donors and ultimately more organ transplants. The gift that lives on. Thank you.
Okay. All right, Hunter, describe an argument from one of your peers' individual reports that made you think differently about your team's solution or conclusion.
So Lydia, she had the ethical lens, and one of her arguments in her paper was that if a patient was either brain dead or in a coma and the family members decided that they were going to donate their organs, that is technically unethical because they're still alive and they didn't make the decision themselves to give their organs to that person. And through my research, I found that I thought it was ethical because you were giving somebody else the chance at a better life, and you're not going to need those organs later on when you're in the ground. So that's the way that my argument, or that her argument, changed my thinking about my conclusion.
Okay. Jacob, describe how the content of the team presentation was changed as a result of your group discussion.
Well, in the beginning, we were gonna focus on how has the shortage of organs been increased the black market of human organs. But as we looked, we couldn't really find very many evidence that support our reasoning for this. So we changed it to, should we legalize the organ black market so we could find economic opportunities, the ethical issues against selling human organs, and also find out the history of how the organ transplants have developed throughout the years.
Okay? And Lydia, in what way did you improve your ability to work with a group as a result of the project?
So during our time working together, we had specific deadlines set for when we needed to complete, our papers and eventually our presentations and our speeches. And this helped me by setting a specific time where I had to get something done. And my group members kept me accountable, and we were able to complete what we had to by the deadlines so we could be well prepared.
All right, thank you all very much.